Stakeholders in the health sector have called for collaborative solutions to tackle the triple burden of HIV, teenage pregnancy and sexual and gender-based violence in Africa. Now speaking during the ongoing international conference on the vice that curtails young people's fundamental rights to quality life, access to education and healthcare, hosted by the AIDS Healthcare Foundation, Elizabeth Glaser Pediatric AIDS Foundation and Africa Reach in Nairobi, the stakeholders say ending triple threat requires mitigation measures like women empowerment, especially education, among other strategies that seek to ensure the well-being of this demographic.
We are seeing a rise in cases. There is also limited funding to support HIV prevention, SGBV interventions, and different in our countries. You see experiences of teenage pregnancies going up because of lack of education, poverty, and all these socioeconomic barriers.
What we also see is the increase on the reporting of sexual and gender-based violence. In 2023, we had about 23,000 reported within our health facilities. And this could be attributed to one, that either the numbers are that many, or that because communities now have stopped using kangaroo courts.
But there still is a need to reduce new infections of HIV and AIDS from mom to the newborn, and not just perinatally, but also during the breastfeeding period afterwards.
Keeping the girl in school, for me, is point number one. Point number two is getting women involved in policy. Because once they're in the policy, they are likely to foster and push in policies that are going to protect the family.
So the Friends and Partners Group of Africa Reach is really bringing all the sectors together to use their voices in different areas, wherever they are, to use the African design messaging to end AIDS in children through ensuring that there's really pediatric and young people focused programming, funding, very much focused on that, on children and young people, as well as ensuring that the funding is sustained.
Now, the